Thank you very much for your invitation. It is my pleasure to be connected with you today. Before exploring this presentation on GICC implementation in Morocco, it is important to acknowledge its positioning within the WHO Eastern Mediterranean region, EMRO. However, I found myself more inclined to perceive Morocco as part of WHO Afro region because Morocco is an African nation. And this is resonating deeply with its cultural and geographical ties to the continent. Furthermore, it is crucial to highlight the significance of the global initiative. This initiative stands as a beacon of unity, rallying nations worldwide around a shared objective. Morocco, as a North African country, serves as a crucial bridge between Europe to the north and sub-Saharan Africa to the south. Despite its geographical positioning, Morocco maintains a deeply rooted African identity reflecting in its culture, tradition, and history. With a population of approximately 37 million people, Morocco boasts a diverse society, blending Berbers, Arabs, and African influences. Its strategic location has historically made it a hub for trade and cultural exchanges between different regions. In terms of healthcare indicators, Morocco demonstrates notable progresses with a life expectancy at birth of 77 years. The country showcases improvements in healthcare access and quality. Additionally, the under 5 mortality rate of 19 per 1,000 births signifies efforts to enhance child health and well-being. Some historical background about pediatric oncology in Morocco. Over the past 4 decades, pediatric oncology in Morocco has undergone significant developments, evolving from 2 small units in Rabat and Casablanca to encompassing 6 dedicated pediatric oncology services across the country today. This growth is marked by several important milestones that have shaped the landscape of pediatric oncology in Morocco. In 1996, the establishment of the Moroccan Society of Pediatric Oncology led the foundation of collaboration, research, and advocacy in the field. Additionally, the creation of the Laila Salma Foundation for Cancer Prevention and Treatment in 2005 demonstrated a commitment to addressing cancer comprehensively, including pediatric cases. The introduction of the University Pediatric Oncology Diploma at the University of Rabat in 2014 further emphasized the importance of developing workforce. Furthermore, in 2019, Morocco was selected as the pilot site for the implementation of the Global Initiative of Childhood Cancer, highlighting the country's dedication to improving pediatric oncology care on a global level. According to Globocon 2020 data, approximately 1,200 new cases of cancer are diagnosed annually among children under 15 years in Morocco. The distribution of cancer types follows the pattern similar to that observed in Europe and North America, with acute leukemia being the most prevalent cancer among pediatric patients in Morocco. The location of pediatric oncology centers across the kingdom is visibly marked in red on the map. 2 centers in Casablanca, 1 center in Rabat, 1 center in Fez, 1 center in Oujda, and 1 center in Marrakesh. Those are public centers. There is additional 4 private centers. This advancement is largely credited to the active involvement of pediatric oncology team and the effective implementation of the National Cancer Control Plan by the Ministry of Health. Furthermore, the efforts are supported by the reinforcement from national NGOs such as the Laila Salma Foundation, as well as international partners. These slides provide an overview of the national NGO involved in pediatric oncology, along with the chronologic timeline of their implementation. With over 20 years of experience, our strength lies in our expertise in pediatric oncology. We benefit from a robust national network and partnership, allowing for collaborative efforts and unified adapted protocol for most diseases. Furthermore, we prioritize sharing challenges and barriers, working together and on solutions to improve patient care. Our training program for pediatric oncologists ensures a skilled workforce, supported by strong NGO backing. Being selected for as WHO pilot site for GICC underscores our commitment to global initiative. However, we still face challenges such as difficulties accessing data, delays in referral, and suboptimal access to accurate diagnosis analysis. Our pharmacy network struggles with drug shortage, and we still have a high rate of early death. Additionally, we lack of centers of excellence and subspecialties. Leveraging our achievements and supported by numerous partners, Morocco submitted a voluntary request to participate in the Global Initiative for Childhood Cancer for the Eastern Mediterranean region in August 2019. Following this, we initiated an implementation process involving an analysis of resources, structures, procedures, and more. However, we encountered a significant obstacle: the challenge of setting a survival target due to the absence of baseline data. This absence impeded our ability to establish clear objectives regarding survival rates, underscoring the importance of robust data collection and analysis in guiding our efforts to improve pediatric oncology care. Thanks to our partner, we conducted a survival survey on the 6 priority pathologies identified by WHO. This survey allowed us to establish our starting point at 65%, providing a crucial baseline for our efforts. With this data in hand, we've set our sights on the target of 80% survival rate by 2030. This ambitious goal drives our commitment to improving pediatric oncology care in Morocco, guided by evidence-based strategies and collaborative partnership. This study has been published in PBC. The study also revealed additional insights. Significant reduction in treatment abandonment rates were noted. However, there remains a concern over the high rate of early death. Furthermore, the study highlighted a prioritizing of acute leukemia and Burkitt lymphoma, where outcomes were not as favorable as anticipated. Once we overcame the challenge associated with this stage, we proceeded with the process. Consequently, the implementation workshop took place on January 21, 2021, in a hybrid format with all stakeholders attending both in person and virtually. The event was held under the strict adherence to pandemic-related restrictions. As a result, we were able to establish a roadmap with strategic axes. First, epidemiologic surveillance of childhood cancer, enhancing the quality of care for childhood cancer across all levels, diagnosis, treatment, follow-up, strengthening the availability of drug and other necessary products, development of supportive care and palliative care. All of those initiatives are supported by enhancing workforce capacity, improving governance structures, fostering research, and promoting innovation. On this slide, you will find the action prioritized in 2021, many of which was being developed over the past 3 years. Under the strategic axis of epidemiologic surveillance and monitoring and evaluation, our initiatives include childhood cancer survival study, conducting a childhood cancer cost study to understand the financial implication, development of the country dashboard to monitor the pediatric hematology oncology action plan. You can see here on this table the progresses made by our group. So most of the activities were completed, such as situation analysis, childhood cancer cost study, childhood cancer plan, and standards for pediatric hematology oncology care study. We are updating our protocols, and access to essential medicine is ongoing. We completed the palliative and supportive care guideline development. The development of National Childhood Cancer Registry is delayed, and the training is ongoing. You can see in this slide the document of our National Cancer Control Plan, the report of the 2 workshops, the publication of the first childhood survival study, and the report of the evaluation of the cost. In these slides, you can see more deliverables, the document of the palliative guide, the supportive care guide, and since December 2022, we have the generalization of the healthcare insurance in Morocco. Other deliverables are the initiation of the hospital-based registry in Rabat and in Casablanca, and we are working on the therapeutical recommendation for the 6 priority childhood cancer. Those deliverables were made possible thanks to the collaboration between our Ministry of Health and the WHO office in Morocco and WHO EMRO region. The last deliverable are the evaluation of the medical practices in pediatric oncology and elaboration of the standards for pediatric oncology services. So what we have learned is that collaboration is a key. Having data is a critical issue. Prioritizing patient-centered care is paramount. Continual improvement is mandatory, and ability in the face of challenges such as the COVID pandemic is an essential issue. In the end, not all of us will be focus countries, but we can act as if we were, supporting one another, setting an example, and instilling hope. Thank you very much.